This is Dr. Ben Kelly from the St. Regis Mohawk Health Service to give another in our series on COVID. Today I was going to talk a little bit about the COVID variant that we hear so much about. Like any other virus or animal for that matter, viruses mutate, and that's natural. And I think for the most part, we call it survival of the fittest because they mutate when they're in unpleasant environments. These mutations that we've recently seen and called variants are named by the country where they first came up. For instance, there's the South African variant, the Brazilian variant, the UK variant, the State Road variant. No, that's a joke, sorry. But it seems that these variants have been able to go pretty much everywhere in the world. And even though this is definitely a concerning event, I think we really need to be very calm and deliberate in our response to it. So far, experts have noticed that the variants seem to be a bit more contagious, meaning they might be easier to pass on from one person to the next. And that sometimes if you're going to get sick, you will get sick a little bit quicker. The good news, however, is that they do not feel, at least as of today, the variants are any more dangerous. The rate of severe COVID is stable. The rate of hospitalizations is actually decreasing, and the rate of deaths is also stable. So we do feel that the existing vaccines do have some effect against the variants. Certainly that is very good news. The Tribal Council is continually asking us what we should do in order to be prepared to fight these variants. Unfortunately, there is no magic wand approach to fighting these or curing them. There was recently a notice that the MCA had a positive variant in their jurisdiction. And to be blunt with you, my guess is there are variants in all of New York State, upstate New York, and on both sides of the reserve. I mean, that's my opinion. Most of the tests that we do not test for the variants. So that might be why we haven't heard anything about them. One of the major things that we can do to fight these variants is to stop them from spreading. How do you think the UK variant got throughout the world? It's because people travel throughout the world. They go to London, they go to Paris, they go to New York City, and some of them even come back to Bombay or Hogansburg. South Africa, the same way. People travel there and then they travel elsewhere. That's how the variant spreads. We're coming into spring break period when a lot of people will be going to Florida. And I have to say, Miami is a very international city. There are people there from all over the world. And I think we need to think about that. I will say this just once so that you don't turn me off. The best way to stop the spread is to wash your hands frequently. Keep 6 feet away from people, especially those you do not know, and protect your own bubble. Also, everybody's favorite, please continue to wear your mask, even if you've had both of your vaccines. There still is feelings that people who have been vaccinated can be carriers of COVID. And I think that the COVID would be surviving possibly in the mucus, in your nasal passages, in the back of your throat, and any phlegm or mucus that you may cough up in the course of activity. As I mentioned, we're coming to the time of year that everybody calls spring break. And because of the weather and just extreme COVID fatigue, everybody wants to travel. And people just can't wait to go down south primarily. Please keep in mind, there is a risk for any type of travel. And I think most of the experts you see on the news, on the internet, in the newspapers agree. What you're doing when you go, let's say Florida, for instance, you're going to an airport, which is full of people. You're getting on an airplane, which is usually full of people. You're landing at an airport, which is full of people that you don't know. You get out at Florida, and most likely you're probably going to go to Disney World, which my understanding is fully booked at this point of people you don't know. Florida has passed a law that gets rid of their mask mandate. So every restaurant and business does not have to wear a mask. And I believe they're also at 100% occupancy. And tonight when you get home, just watch the nightly news and see all the people in restaurants and bars without masks, shoulder to shoulder. Maybe you're braver than me, but it scares the heck out of me. And I think that we need to keep that in mind when you make any kind of travel plans. Also, please remember and read up on the internet wherever your children go to school. If you take them out of state, they may have to quarantine before they go back to school. And of course, those of you who work for the St. Regis Mohawk tribe, the same thing goes. You have to quarantine when you come back from an out-of-state trip. And that certainly adds days, takes away from your vacation and things like that. So please think twice before you travel. I will, in closing, I have a couple of things. Again, as we all know, the knowledge of this disease changes almost every day. We will attempt to keep you abreast of those changes as best we can on a daily and weekly basis. Our point at this time is to keep the original COVID from spreading and certainly keeping the variant COVID from spreading. Two points in closing. One is for people who are isolated or quarantined, please answer your phone. I know we all get in the habit of looking at the caller ID, and if it's somebody you don't recognize, you don't answer it. The patient tracers in St. Lawrence, in Franklin County, in here with the tribe are just overwhelmed. And a lot of tracers are calling from Saratoga, Schenectady, Cortland, Jefferson County. So if you are under quarantine or isolation, please answer your phone, even if it's a number you don't recognize. If it's a pesky salesman, you can always hang up. But if you don't answer for a patient tracer, they're going to think that you're not following your quarantine. I think that that's all I have to say for today. And I know it was a mouthful, and I know you probably don't agree with everything I've said. We're going to try it again and have weekly providers from health services talk to you. Please feel free to send in or call in any questions you may have that you don't think we are answering. Thank you very much and have a good day.